Dear students, hello, good morning to all of you. Today's topic in the section on cardiology is on systemic hypertension. So, this is a very important topic from the point of view of daily practice in medical field, and it has been found that about 1.56 billion people will be suffering by 2024-25 because of this condition. So 1.56 billion. So what is hypertension? It is a condition in which the systemic blood pressure of a patient remains chronically elevated. Now, this systemic blood pressure is of two types, that is systolic and diastolic, as you know from your knowledge of clinical methods, systolic BP and diastolic BP. So when any of this BP is raised or both are raised, the condition is termed as hypertension. It is equally important to treat whether it is systolic hypertension or diastolic hypertension or both, because the condition is labeled as silent killer. The patient doesn't know what is going on in his body, and ultimately he lands up with various complications of hypertension. That is why it is called as silent killer, because the patient doesn't know that some pathological processes are going on inside his body. So the definition is raised level of blood pressure on three different occasions, and while the patient is physical and mentally at rest, and the BP is taken in lying down posture and sitting posture. And it has been found that the BP on the two sides of the body, that is upper arm right and left upper arm, may vary by 10 millimeter of mercury. Now there are different classifications of blood pressure. Commonly followed is JNC, Joint National Commission on Hypertension classification. According to this classification, less than 120 by 80 is labeled as normal BP or optimal BP, and then up to 120 to 139 is taken as pre-hypertension. Systolic 120 to 39 and diastolic 80 to 89. This is pre-hypertension. Then there is hypertension stage 1 and stage 2. In stage 1 it is 140 to 159. This is pre-hypertension. In stage 1 hypertension, 140 to 159 systolic and 90 to 99 diastolic is taken as hypertension stage 1. And in hypertension stage 2, more than this level is taken as hypertension stage 2. Now this is according to the Joint National Commission on Hypertension classification. Now this should be clear to the students as well as to the public that sometimes there may be a transient rise in the blood pressure because of fear, anxiety, exercise, emotional disturbances, but that remains normal in other situations. So such a patient does not need any antihypertensive drug, that needs the treatment of the cause. That means he should be taken for mental assessment by a psychiatrist, or accordingly exercise etc. should be adjusted according to the pressure levels. But in any case, if the pressure remains high, it should be brought to the notice of the physician that which type of exercise should be advised by him. And most important, that Shirshasana, which we usually advocate in Ayurveda, it should be avoided in patients who are having hypertension. Now there are certain terms which are used in hypertension. Common terms. Number one is labile hypertension. First term is common terms, labile hypertension. Labile means variable. Sometimes there is hypertension, sometimes the patient has normal blood pressure. Such patients who have increased levels only at certain times and not having otherwise, so such patients may turn out to be hypertensive at a later stage. For example, if a patient comes to a hospital or he sees some traumatic experience on roadside accident etc., his blood pressure may get rise, but it comes down after the situation is avoided by the patient. But such patients are likely to convert into regular hypertensive patients. Second is white coat hypertension. White coat hypertension. Now this is, as you see, that the doctors usually wear white coats in the OPDs, while the patient goes into the OPD for getting himself checked by the doctor, his BP suddenly rises. But otherwise his BP remains normal, so such a patient may not need any antihypertensive medicine. Then there is third condition, that is isolated systolic hypertension. Isolated systolic hypertension. Now in this condition, the systolic blood pressure is raised to more than 160 millimeter of mercury, whereas the diastolic pressure remains within normal range up to 80 or something like this. So such patients occur usually in old age groups due to arteriosclerosis. So such a condition is isolated systolic hypertension. Other causes may be aortic regurgitation, thyrotoxicosis. So in these conditions there may be systolic rise in the blood pressure, but the diastolic blood pressure may be normal or below normal. As I have told you in the video on aortic regurgitation, the systolic blood pressure may go up to 200, but the diastolic BP may be up to 0 or 20. So the gap, that is pulse pressure, is wide, producing, that is water hammer pulse, that I have told in the aortic regurgitation lecture. Similarly, in thyrotoxicosis also the patient may have wide pulse pressure. So this is called isolated systolic hypertension. Then fourth term which is usually used is accelerated hypertension. Accelerated hypertension. Now what happens? The patient usually is controlled with the drugs, but due to certain situations there is sudden increase in the blood pressure. Now this type of picture leads to various organ damages which may be during the period of sudden rise in the blood pressure. That organ damage may be in the form of retinal hemorrhages, may be kidney involvement, may be heart involvement, even brain involvement may be there. So, in accelerated hypertension, there is sudden rise in the blood pressure which may lead to various complications due to involvement of the arterial vessels. But the important part is on fundus examination, that is ophthalmoscopic examination, there will not be any papilledema. Target organ damage will be there, but papilledema will not be there. Target organ damage. Now, what are the various target organ? I just to bring to your notice, starting from above, brain. Number 2, eyes, that is retina. Number 3, heart, may lead to MI, myocardial infarction. Then kidneys may lead to kidney failure. And last one, peripheral vessels may lead to gangrenes, etc. So these are various target organs which may be affected by the sudden rise in the blood pressure. Then the last term, which is very important term and dangerous term, is the malignant hypertension. Now, what is malignant hypertension? Why it is called malignant? It has nothing to do with the carcinoma or cancerous thing. Malignant means it is highly dangerous for the patient. There is sudden rise in the blood pressure in a patient more than 200 to 130, 140 levels, more than 200 to 140 millimeter of mercury. Now, this level may lead to the same target organ damages like brain hemorrhage or thrombosis, retinal hemorrhage, MI, kidney failure, etc. Along with this, on ophthalmoscopic examination, there will be papilledema. Papilledema is swelling of the optic disc. So this is optic disc as we see from the ophthalmoscope. In this is optic disc. Now this optic disc, because of swelling, it becomes like this, blurred margins. This is called papilledema. So presence of papilledema in a patient with raised blood pressure is labeled as malignant hypertension. As I have told you that malignant means very serious. Now this is about terminology used in patients of hypertension. Now coming to the classification according to the etiopathogenesis. Classification of hypertension. This is very important. This classification according to etiopathogenesis it is of two types: primary hypertension and secondary hypertension. Primary, also known as essential hypertension or idiopathic. It has three names: primary, essential, idiopathic. Secondary hypertension is non-essential and it has certain cause, so it is secondary hypertension. Now the classification is important from the point of view of diagnosing whether the patient is suffering from primary or secondary, because in secondary hypertension, if you find a cause for the hypertension, we can treat that cause and the patient is permanently cured of the disease. But in primary hypertension, because it is idiopathic, usually the cause is not known, so that may be that the patient has to take medicine for whole of the life. Now in coming to the primary hypertension, in about 90 to 95% of patients, very important, 90 to 95% of patients, the hypertensive group is of primary hypertension. So very big group, because the exact cause is not known, and it has been found the various factors which are important for this condition, like genetic factors, that is genetic inheritance, our parents, our grandparents, our siblings are also suffering from hypertension, it is in our genes. Then there are racial factors like blacks, American blacks, Japanese, they are more prone to hypertension. Then third factor is dietary factor. Dietary factor, in some societies lot of salt is taken in the meals, so that may act as an important cause of the hypertension. Now what is the basic pathology? The basic defect is in the lining of the vessel. Now this is say artery. It has three layers: tunica adventitia, tunica media, and tunica intima. Now what happens? The lining of the tunica intima, the cells, they get hyperplastic. There is endothelial hyperplasia. Endothelial hyperplasia, which leads to narrowing of the arteries and leading to increase in the peripheral vascular resistance, which culminates in the process of hypertension. Or secondly, it has been found there is defective development of the smooth muscle in the tunica media also. So this has been hypothesis, and usually it has been taken as the pathogenesis of idiopathic or primary or essential hypertension. That means genetic inheritance, then racial factors, then there is endothelial hyperplasia or defective development of smooth muscles of the vessels. So this is regarding primary hypertension. Now the second batch is the secondary hypertension. Secondary means you have some cause for it, and that is the main aim of a physician is to differentiate in a patient of hypertension whether he is having secondary or primary hypertension. Because as I have told you earlier, secondary hypertension cause, if we are able to find, we can treat that patient permanently. Now what are the various causes of secondary hypertension? Number one is renal causes. Renal means kidney related. Number two, endocrines. Endocrines. Number three, drug induced. Number 4, collagen disorders. Collagen disorders. Number 5, pregnancy induced. Pregnancy induced. And number 6, congenital, like coarctation of aorta. Now coming to the renal causes. In the renal causes, the conditions, write down the conditions. Number 1 is acute, as I have already told you that secondary hypertension is seen in 5 to 10% of patients of hypertension. Primary is seen in 90 to 95% of patients. Now I will again request you, as in my previous videos, go to the Google Play Store, open my app Dr. Ashok Kumar Rana from the store, subscribe to it, and you can find so many topics on your subject free mode. As well as you purchase the course, you will find so many detailed topics as per your syllabus. So go to Google Play Store, as you feel these topics of cardiology, neurology, I have told almost complete neurology except 1 or 2 chapters. Most of them has been taught in the videos. So cardiology will also be over in 2-3 lectures. So subscribe to the app, purchase the course, and enjoy the reading of medicine. It's a very nice subject and entertaining and understanding subject. So what are the various kidney causes? Coming back to the topic, in renal diseases, number 1 is acute and chronic glomerulonephritis. So acute and chronic glomerulonephritis, here I will write acute glomerulonephritis or chronic glomerulonephritis. Then polycystic disease of the kidney. Polycystic means the kidney has multiple cysts on both sides. It is a bilateral condition. And genetic disorder. These are cysts. Multiple cysts, poly means multiple, on both kidneys, and other organs may also be affected like pancreas, liver, spleen. So it is a polycystic disease of the kidney, second cause. Number 3 is chronic pyelonephritis. Chronic pyelonephritis, that means chronic infection of the kidneys. And then renal artery stenosis. The artery which is supplying the kidney is stenosed. It is genetic, congenital. So I have seen a patient of renal artery stenosis about 15 years back. That lady was having stenosis of one kidney, rather both kidneys. So we diagnosed it from the IVP, intravenous pyelogram, and we got that patient operated at PGI Chandigarh, and that patient became all right after the treatment. So congenital renal artery stenosis. So these are causes of renal causes of secondary hypertension. Then endocrinal causes, they include number 1 myxedema, that is hypothyroidism. Number 2 hyperthyroidism. Number 3 pheochromocytoma. Thyroid key diseases, hypo and hyper, endocrines, both down and up. Then adrenal, medulla, that is pheochromocytoma, tumor of the adrenal medulla. Then we have parathyroid gland diseases, hyperparathyroidism, pituitary gland disorders. So any endocrinal disease, pituitary gland, acromegaly, big hands, big face, big eyebrows, big lips, big tongue, everything. Acromegaly means big, mega sized. Fingers, like me, it is double than this. Big hands, thick lips, thick nose, moti eyebrows, big bossy head. So this is acromegaly. It occurs because of involvement of the pituitary gland. Then there may be Conn's syndrome because of adrenal cortex involvement and adrenal medulla involvement. Cushing syndrome is adrenal cortex and adrenal medulla pheochromocytoma. So these are endocrinal diseases: hypothyroidism, hyperthyroidism, Cushing syndrome, Conn's syndrome, then coming to the pituitary gland, acromegaly, and primary hyperaldosteronism and hyperparathyroidism. Now these are important endocrinal disorders which may lead to secondary hypertension. Then third cause is drug induced. Very important. Drug induced, certain drugs if taken for a long period of time may lead to hypertension. These drugs are: number one, non-steroidal anti-inflammatory drugs. Very important. NSAIDs, they are labeled as NSAID. Non-steroidal anti-inflammatory drugs. Then second drug is corticosteroids given for various chronic conditions. Corticoids. Then number three is oral contraceptives, OCC. So these common drugs may lead to secondary hypertension if taken for a longer period of time or without any prescription. Then pregnancy related. As you know, gestational situation leads to pregnancy induced hypertension that occurs in the last trimester of the pregnancy. It is known as PIH, and it may lead to preeclampsia and eclampsia. Eclampsia means eclampsia. Eclampsia means conversions in a patient of hypertension associated with albuminuria, swelling of feet, and raised blood pressure. This is a very dangerous condition, eclampsia, because it is fatal if it is not treated in time and the delivery is not conducted by any means, maybe normal, maybe cesarean section. Then collagen disorders. In collagen disorders, the important condition is polyarthritis nodosa, PAN, SLE, systemic lupus erythematosus, and chronic rheumatoid arthritis. These are common collagen disorders. There may be other disorders which are uncommon that may also lead to the situation of secondary hypertension. Then in coarctation of aorta, which is a congenital disease, the hypertension may also be found out. So this is regarding the etiopathogenesis of the condition of hypertension. So again, before concluding rest of it, that is clinical features, investigations and treatment, will be in the next video. I will give it to you. So I will request you to go to Google Play Store, open my app Dr. Ashok Kumar Rana, and subscribe to it, like it, and you will find so many subjects which are free. They may be free text also. Then you purchase the course, you combine 5, 7, 10 students and get the discount by giving your comments in the comment box. So wishing you all the best. Thanking you.